Greeting of the day. I am Dr. Shweta Singh from Forensic Science Department, Kristu Jayanti College, Bangalore. And today we will be discussing about the topic corrosive acids. Now, what are corrosive acids? These are the substances which causes ulceration or inflammation of the tissue they come in contact with. Now, coming to the classification of corrosive acids. Corrosive acids are classified into strong acids and strong alkalis. Now, strong acids are again subclassified into inorganic acids and organic acids. So, today we are going to discuss about the inorganic acids, which include hydrochloric acid, sulfuric acid and nitric acid. Now, these are acids which have a very strong acidic nature. Therefore, they can lead to necrosis of the tissue. Now, the first acid is sulfuric acid. Now, coming to the properties of the sulfuric acid, it is colorless, odorless, it has a burning taste, it is oily or dense in nature, and it is non-fuming at the room temperature. Now, let's talk about the action of the sulfuric acid. The action, it is divided into local and indirect. Local action is the direct action. That means if it is going to come in contact with your skin, it will lead to ulceration or inflammation of the tissue. That is the local action. Now, coming to the indirect action. Now, indirect action, it occurs due to the inhalation or ingestion of the sulfuric acid, and it can lead to shock, asphyxia, perforation of the stomach, inflammation of your mucous membrane, and it can narrow the esophagus, the lining of the esophagus. Now, what is the fatal dose of sulfuric acid? It is in the range of 5 to 10 ml, and the fatal period is 24 hours. Now, what are the signs and symptoms of sulfuric acid? If someone has inhaled or consumed it, then it is going to cause the oropharyngeal burns, which includes your oral cavity and the throat, and it will also lead to the burning pain in throat and epigastrium. Epigastrium is the upper part of your stomach. Then it can lead to dysphagia, dysphonia and dyspnea. That is, you will face difficulty in eating, in speaking and in breathing also. Now, the third symptom is it can cause irritation, and it can also lead to vomiting, and the vomit in this case, it will be strongly acidic and it will be altered with the blood and the mucus shreds. Then your teeth, they can become chalky, white and brittle, and there will be anuria, that is your urination, it will be suppressed, and this can also lead to the stiffness of your abdomen, which is basically due to the inflammation. And the main symptom is that it will cause erosion of your skin, mucous membrane of mouth and tongue, and it can also cause perforation of the stomach. Now, these signs and symptoms will also be similar in case of HCl and nitric acid, in case of hydrochloric acid and nitric acid, and only one symptom will differ, that is perforation of the stomach. Perforation of stomach is present in case of sulfuric acid, but in case of nitric acid and hydrochloric acid, it will be absent or it may be present on the basis of the concentration. Now, what are the post-mortem findings that you are going to find in case of sulfuric acid? First is, according to the signs and symptoms, you will see the erosion of the skin, and it will be near your mouth and lips. Then there will be corrosion of trachea and larynx, and then you will find blackish charring of the stomach, and it can also lead to perforation of the stomach, and you will find swelling in case of liver and kidneys. Now, coming to the second strong acid, that is nitric acid. Now, coming to the properties, it is colorless, pungent, and it can cause choking, it has a burning taste, and it is fuming under the normal room conditions. Now, again the action, it is divided into local and indirect, as I have mentioned in the case of sulfuric acid. The fatal dose for nitric acid is 10 to 15 ml, and the fatal period is 24 hours. The sign and symptoms are similar to that of the sulfuric acid, and only you will may find there will be presence of perforation of the stomach. Now coming to the postmortem findings of nitric acid, it causes yellow discoloration of the skin. It also causes corrosion of your skin, and the larynx and trachea, they will be congested, and your stomach wall, it will be soft and fragile due to the inflammation that was caused by the acid. Next is hydrochloric acid. Now coming to the properties of hydrochloric acid, it is colorless, it has a pungent smell, and it has a burning taste, and again this is fuming in nature. And the action it will be same as of the sulfuric acid and the nitric acid. The fatal dose for hydrochloric acid is 15 to 20 ml, and the fatal period is 18 to 30 hours. Now coming to the postmortem findings of hydrochloric acid, in this case there will be not much corrosion of your skin, as it is less acidic as compared to the sulfuric acid and nitric acid. But it can lead to brown discoloration of your tissue, and your tissue, they can become very dry and leathery, and it can resemble that of a parchment paper, and there will be inflammation of your respiratory passages, and your stomach, it will contain the brownish fluid. So all these postmortem findings are related to the hydrochloric acid, and again the symptoms, the sign and symptoms, they will be similar as in the case of nitric acid and sulfuric acid. Thank you.